Hey folks, I want to give you a quick update on our preoperative note. There have been a fair number of questions about that, a fair number of changes. So I want to clarify some things with the note and show you some of those changes. This is our anesthesia summary, which comes up on every patient. You'll recognize that that's the M page that comes up. The first place you'll start typically is with documents, is to look for a note. And where you go is existing notes. If the patient has an existing note filled out by the night before by a provider, or if they've gone through pre-op clinic, you'll see those preoperative notes in progress here. And so you can select the latest note by the provider and go ahead and load that and then add to it. If, however, the patient was not seen the night before, there's no pre-existing note, you'll go ahead and grab one as a new note. And so we'll do that in this case. You'll see your pre-population or your auto-population screen that'll show up, and you can determine what flows into your note. All of these things are items which have been entered by a nurse or a clerk as the patient's gone through the preoperative checklist, or if they've been just entered in the hospital as a patient. So all their meds will be listed, and you can determine what or what not will flow into your note. We're going to select everything, and you can see, just like our anesthesia questionnaire on paper, all the elements will flow through, including weight, their preferred name, allergies, the procedure. If the nurse has entered that will flow if you selected that on your auto-populate. Go down the list here. All the meds will flow. Their problem list. Here you can see all the problems that they're listed as active problems the patient has. The nurse or the pre-op clinic will ask a series of questions, just like on our anesthesia questionnaire when it was on paper, related to GU, GI history, ortho history, endocrine. If they've asked all those questions and they're negative, this is where they'll list that. If the patient hasn't been asked these questions, there will be nothing here under past medical history. And so if the section below the review of systems is really for us, the only people that can alter this are clinicians, either CRNAs or physicians, or Jane in the preoperative clinic. And so those folks will be the only ones who can enter or not enter here. All the nursing data will not flow directly into these, and that was a confusing thing for folks before. Otherwise, the things that are pretty similar, all the physical exam, airway, respiratory, some of those things we've changed to expand. We'll continue to change a few more things per your requests as those go on. We've added a few things like echo results here and stress tests. Eventually, those will be put together, but you can put your information here. Labs will show up here, and again, in your auto population list, you can determine what or what not comes into for labs. The bottom is no different than it was before. You still need to the provider who's doing the case the day of surgery. The anesthesiologist needs to put his or her plan in, and per your request, we've also we're going to add we're going to flesh out some more areas under plan so that you can add more detail into that.